Well, good afternoon, everybody, and welcome to GPA Live. I'm your host, Ron Aaron Eisenberg. GPA Live, a virtual education series, is brought to you by the Global Pain Association. And every week we come to you with a different topic, with an expert guest, and we hope those of you and their loved ones who may be dealing with chronic pain are able to learn something about how to deal with a particular issue. We also invite you to join us in the chat room if you've got questions as we talk about arthritis and how to fight stiffness, which often accompanies arthritis. If you got a question, post it and we will pass it along to our very special guest today. Ways to manage stiffness in arthritis, and Dr. Benjamin Pendleton Wickersham from the Arthritis Association is joining us. Arthritis Associates, pardon me. He is our expert today. We've had him on before, also a member of the board of the Global Pain Association. And we're going to take just a moment to welcome those of you who are joining us in the chat room. I also want to invite you to share this program so that others who may be within your pool of friends can join us. So if you're on Facebook and watching us on Facebook Live, just click share and send it out to your folks so they can come and join us as well. And again, remember, post questions you may have for Penn. Susan Blackwood, who normally joins us at this time, who is the founder and president of the Global Pain Association, is on special assignment today. So let me just share with you that the Global Pain Association, put together by Susan, is designed to help people who deal with chronic pain. It provides a resource, it provides an access to information as well. And they also have a new support group, GPA Warriors, which meets the second and third Tuesdays of the month. If you go to the Global Pain Association Facebook page or the website, you can register for the GPA Warriors, absolutely no cost, and it is a support group that is facilitated by Dr. Marianne Pinkston. I mentioned we're going to be talking with an expert on arthritis. Let me introduce Dr. Pendleton Wickersham. He's a partner in San Antonio's Arthritis Associates, earned his medical degree with honors from Baylor University College of Medicine in Houston. He's board certified in internal medicine and rheumatology, a partner in the San Antonio-based Arthritis Associates. He consults and speaks before many groups and has invented several medical devices. Penn is the leading physicians of the world 2011 to 2018. Texas Monthly named him a super doc 2015 to the present, and he is a board member of the Global Pain Association. So it is a real pleasure to welcome Dr. Wickersham. Thanks for joining us.
Thanks, Ron. I'm glad to be here. This GPA in general and GPA Live is near and dear to my heart. So,
well, for those who are new, perhaps, to this broadcast and haven't had a chance to learn your background, what got you involved in the whole issue of arthritis and chronic pain?
Well, I was really fascinated in medical school by rheumatology. I liked the complexity and I liked the long-term relationships with patients. But on my rheumatology elective in Houston, I actually had a major flare, my first major flare of my arthritis, and I got diagnosed with my very own arthritis. So it's very much a professional interest, but it's also a personal interest for me.
And as you began that journey dealing in your own self with chronic pain, let's talk a little bit about what that's all about. What is arthritis? What causes chronic pain? And I think we have some slides that we're going to support your talk with.
Sure. So today thanks, Ron. Today we're talking about stiffness. And so, you can't really talk about stiffness without talking about arthritis, because in general, that's the cause of stiffness we're covering here. And so when I thought about this presentation and about treatments for stiffness, I thought we should really start with understanding why the stiffness happens in the first place. And turns out it's not straightforward. There's been a lot of research over many decades now to try to understand this, and there are a lot of different factors that go in to cause stiffness of the joints in people with arthritis. The first and probably the most important is scarring or fibrosis of the joint lining, and that very clearly happens. So the normal joint lining is a really, really thin, one-cell thick layer over the cartilage, and its job is to produce fluid to lubricate the joint, and to nourish the cartilage. So there's decreased lubrication once that layer starts to scar, which means things are grinding a little bit and stiff. It also means that, scar tissue is tough. And if you've ever cut yourself and watched the skin kind of pull together and pucker, you can imagine what's supposed to be a flexible, smooth, happy layer on top of the cartilage. If it scars down, it's going to really restrain the joint. Inflammation is another cause of stiffness, and that has a couple different reasons. One is if a joint swells, there's just not enough room for it to move. But another is inflammation directly causes changes to the muscles and tendons around the joint. So that's partially weakness from not being able to use the joint as much, but that's also some fundamental changes in how the muscles and tendons work. And so you have this joint that's harder to move, and yet the mechanism, the body's machinery to move it, is actually affected as well. Next slide here. So manifestations of stiffness, how it really presents, how people really experience this is, first of all, decreased range of motion. And you could think about someone with a bad knee, it just doesn't move as well. I think what's also important is it's a lot harder to move. So because of that stiffness, the effort required to move the knee the same amount, or the hands for someone with hand arthritis, or the hips or the back, is significantly increased. So it's hard to make the joint move. And then finally, there's the gelling phenomenon. And anybody with arthritis will understand the gelling phenomenon. That's a situation where after being still for a few minutes, it can be as short a time as 10 minutes. It can be as long as 30 or 45 minutes. The joints almost seem to gel. Like if you took a bowl of liquid Jell-O, you put it in the fridge for 30 minutes and it starts to solidify. That's what it feels like happens to the joints. And pretty much everybody with arthritis has had gelling phenomenon, at least at some time.
Now, let me point out before we move on, where on that slide you've got that highlighted in red. My wife occasionally will ask me to rub her hand in exactly that place because she's got pain in her hands.
Absolutely. Well, and that is arthritis. You always have to be careful about hand pain because there are other things that can cause hand pain, like carpal tunnel syndrome, which is really common. But in general, that's probably arthritis. Women in particular are very prone to get arthritis at the base of the thumb, right here where I'm pointing. So I'll point on the other side here so you can see right there, the base of the thumb is typically involved. And so that's
Let's
probably
have you do that again. Point
Let's
again.
see if I can do a better job on the camera here. So
we didn't have you on camera. Yeah.
Right there. So
that's
that joint right there is incredibly commonly involved in people with wear and tear arthritis or osteoarthritis, and especially in women, and especially in the dominant hand.
How many people have arthritis?
Oh my goodness. So it sort of depends how aggressively you look. We know in the U.S. it's upwards of 30, some estimates 40 million. So it's incredibly common.
And everyone by the time they're 80 will have it?
If you live long enough, you're probably going to have some degree of arthritis, but a lot of it's genetics too. So I'll see people who get it at 50, and I'll see people who are 70, and they're just starting to get it. Wow. So that varies pretty widely.
So what do you do about it? Talk to me about treatments.
Sure. So from a stiffness perspective, I think the most important treatment is motion. And that means frequently moving. For those people who really struggle with that gelling phenomenon, it means getting up and moving around a lot throughout the day, not sitting for prolonged periods. Now, it doesn't take much. You don't have to go for a jog. You can simply just walk around the room one lap and sit back down. But that movement helps. Low impact exercise helps as well. And by that, I mean walking or light weights or exercising in the pool. And it helps because it improves those tendons and muscles that are affected by arthritis, like we talked about earlier. It also has been shown to directly improve the lubrication of the joint. So people who exercise pretty regularly have significantly less joint pain. Now, in the studies, I'll tell you, the most recent literature suggests that you got to be active right about 5 days a week to see the most benefit. So a couple days a week is not enough. You really have to make a commitment to it. So injections also can help. A lot of people get steroid injections. They can be done in almost any joint. The problem with steroid injections is not that they don't help, it's they just don't help for very long. Generally, a steroid injection lasts 3 or 4 months initially, and subsequent steroid injections do a little bit less each time. More and more steroid injections can also break down the cartilage somewhat, but too many. So now there's hyaluronic acid, which is a gel. It's this goopy, viscous, gelatinous material that's injected into the joints, predominantly into the knees. That's where most of the literature is. And it's supposed to lubricate the joint. To be honest with you, we don't 100% understand how it works, but it does work for most people. It was originally made by scalping roosters, by taking the comb off roosters. But now most of the new products are made in the lab.
So I have to ask you, you're the inventor. How does somebody think about doing that? Taking off a rooster comb, grinding it up, and turning it into liquid and
So
injecting it.
it does seem a bit bizarre, right? How did somebody
It
come up with that
does.
plan? I think they knew they were looking for a certain molecule, the hyaluronic acid, with this massive molecule that's really goopy, and they searched through the animal kingdom to find the cheapest place to find it. Honestly, that's what I
Interesting.
think happened there. So
And they now synthetically produce it for the most part, right? We're not
absolutely,
scalping roosters all over the country.
it still happens some, but no, most roosters aren't harmed anymore. So
So it's synthetic. That's pretty cool.
absolutely. Now, supplements also work, and anybody who knows me knows supplements are near and dear to my heart because they really can be beneficial. For arthritis in general, and especially for stiffness, though, there's no one-size-fits-all approach. And so I would encourage you, if you're struggling, to keep trying until you find the right treatment or the right combination of treatments. I particularly like supplements because for most of my patients, they are safer but still potentially have some benefit. Glucosamine and chondroitin have been used for decades. The problem with that product is that the studies that showed the most benefit were in general paid for by the manufacturers of the product. And
Well, it
when
raises issues.
absolutely. So there are some ethics issues there. The larger studies have not shown it as consistent a benefit, but we do know when they actually tag the glucosamine pills with a little bit of a radioactive isotope and people take it, it does localize to the knee in particular. So for about 50% of my patients, glucosamine has some benefit, although that can take several months. I'm a big fan of turmeric, in particular the extract of turmeric, curcumin, which is a natural anti-inflammatory. Have to be careful with it, though, because it does thin the blood a little bit, and it does have some potential drug interactions. So that's when I would discuss with your healthcare provider before starting. Boswellia is an extract of the sap from the Indian frankincense tree. So they boil down the sap and concentrate it and get boswellic acids, and that functions as a natural anti-inflammatory. This has to be taken with food to be absorbed and occasionally causes some stomach upset. Omega-3 is really beneficial. There were some studies from 20 plus years ago that showed at high dose, 8 grams a day of omega-3, dramatic responses in osteoarthritis. But that's a lot of omega-3 to take, and it's hard to be confident that you're actually getting good quality omega-3 because a lot of it's made in the lab as opposed to being extracted from algae, which is how fish oil is, because fish eat the little tiny aquatic plants.
So eat a lot of salmon.
Absolutely. And that's one of the reasons that salmon is so recommended, right? Because it's high in omega-3. If you look historically at human diets, 10,000 years ago, our ratio of omega-3 to omega-6 was about 1-to-1. We ate about the same amount of omega-6 as omega-3. Now in the Western world, because of corn, which is omega-6, being used to feed animals and our really dependence on corn, our ratio is more like 5 or 6-to-1. So we're getting way too much omega-6 relative to omega-3. Avocado, soybean, unsaponifiables, say that 10 times fast, right? ASU. It's a really interesting product. So in the European Union, this is actually a prescription. It's been used for decades for arthritis. It's called pisclidine. That's the generic name over there. But in the U.S., it's actually a supplement, and it really does help a lot of people. The challenge with this one is finding it because it's not so easy to get, and then taking it for long enough because this can take several months to have clear benefit. And there are many others. So this is not intended to be necessarily a comprehensive list of supplements. This is just kind of a starter list. But I encourage those people who are struggling with arthritis and stiffness to keep trying and keep looking till they find what works for them. Next slide here. So before I cover the next slide, let's talk a little bit about diet. I didn't have it in this talk, but we got a question about diet even before we started the talk today. So I'll mention that briefly. Diet's tough because if you Google arthritis diet, I think you get, how many different million diets listed, right? And so it's hard to know what to do. And diet can be very personal. It takes a lot of experimentation. But there are 3 pieces of diet which I find help most of my patients. Number 1 is avoiding refined sugar. And so that means not having sweets. Number 2 is limiting gluten. So gluten is inflammatory in the gut, and the way wheat is grown these days by the big corporation farms means that it has 5 or 6 times as much gluten in a slice of bread than was in the 1950s. And so we are all getting this massive gluten exposure by eating the routine Western diet. And this is not to say that people have celiac disease, which is an autoimmune disease with allergy to gluten, and that you can't be in the same room with gluten. Not at all. It's more of a dose issue. So limiting that exposure to gluten can help. And then finally, avoiding processed foods is crucial. So processed foods have a couple of negatives. One is generally they're pretty close to sugar or have a lot of sugar in them. So we're back to reason one. But in addition, if something will stay on your shelf for 5 years and still be good for you to eat, you probably shouldn't put it in your body.
Like Twinkie.
Now, exactly. And again, it doesn't mean you can't ever have a Twinkie, but in general, it's not good for your joints.
100 years from now, archaeologists will find Twinkies in people's homes, still good to eat, right?
And probably enjoy them, right? The other things for diet, because diet is very personal, some people find they're sensitive to dairy. Other people have done a low lectin diet. Other people have done the nightshade food avoidance. There's a lot out there. And so after you do sort of the big 3 components, it's reasonable to individually pick a potential offending food item and pull that out and sort of experiment. But some of the diets online are so restrictive, they're almost impossible to do. All right, let's cut back to the slide here, and we'll talk about a couple of other treatments here. Acetaminophen, good old brand name Tylenol, actually helps. It helps with the stiffness and it helps with the pain of arthritis. The problem is you can only take 2,000 or 3,000 at most milligrams a day if you take it regularly, and you can't drink any alcohol with it. Non-steroidal anti-inflammatories, and that's things like ibuprofen, naproxen, brand name Advil, Aleve, Motrin, that type of thing, really work. And when I started in practice, that was one of the mainstays of our treatment. We've come to learn that there are side effects, though, including stomach ulcer, effects on the kidneys, potentially an increase in blood pressure and cardiovascular risk. So it's prudent to be careful about using these. Now, that's not to say that people can't take the occasional ibuprofen over the counter, but if you're interested in taking something like this on a regular basis, again, this is where you should talk to your healthcare provider, make sure you're a good candidate and you're being monitored for safety. And then I even hate to put it on the slide, but people do sometimes take pain medications. Our hope, of course, with GPA is that people are not having to be so dependent on pain medications because of all the other treatments we've talked about. And then finally, surgery. So joint replacements are massively large surgeries, right? Having a knee replacement or hip replacement is a big deal, but they do work. They just require 3 to 6 months of pretty dedicated effort at recovery. But by and large, patients do well. And these days, we're starting to see this spread out to include shoulders as well. So that's all I have, but I'll be happy to take some questions here. And Ron, I think you're muted here. So let's see if we can get you back on. I still can't hear you. So while you're working on getting unmuted, what I'll do is I'll put a plug in for GPA. Since our president, Dr. Susan Blackwood, can't be here, as a board member, I want to say how important this organization has been. It's helped, I think, a lot of people. If you're curious about learning more, if you're curious about the support group, which Dr. Pinkston has been running and doing a great job with, if you're curious about donating, heck, if you're curious about just volunteering, because we can always use the help, go to globalpain.org or shoot an email to info@globalpain.org and you can learn more. All right, so I'm scrolling through the chat here, and let's see some of the questions. So I have a question here from Maurice Hawkins. What do you think about bracing with the other treatments and supplements? So it's sort of an interesting idea here to talk about bracing when you're talking about stiffness, right? Because by definition, a brace kind of stiffens up a joint. And I think bracing actually can be incredibly effective for arthritis, but it seems to do so predominantly with activity. So in other words, if I have a patient with arthritis who has a lot of pain when they're trying to do something, the brace can really help unload that joint to take some of the pressure off the joint and really improve the pain significantly. So bracing is great. Let's see what else in the chat here. So I got another comment here. Love the hyaluronic acid. God bless the rooster. Indeed. Thank goodness for the hyaluronic acid and those roosters who have so bravely given up their their combs for the for the health of the knee joints, because they really have helped a lot of people and put off things like a knee replacement for many years for a lot of my patients. All right, sounds like we are getting some. Sounds like you're back. All right, our fearless leader here, Ron.
Yeah, I'm
There
back.
we go.
I'm back.
Excellent.
Lucy, our dog, unplugged me, and I couldn't get it back.
You know, doing these things at home is always interesting, right? So you just never know. You never know what's going to happen.
Right. So I moved on to my executive producer's desk, my wife.
Gotcha.
Now, did you get the question that Dr. Pinkston asked? What's your feeling about stem cells?
So that's a fun question for me, because I am very excited about the potential for stem cells. So not to get too much in the weeds about it, but stem cells, when used properly, have been shown to regrow cartilage up to 66% of people who have treatments. There was one Czechoslovakian study in particular that did almost 1,200 injections for people, and right at 2/3 of those people for their knees regrew cartilage, which is just amazing, right? The challenge is, how do you get the stem cells? How do you make sure they're safe, et cetera? So what I think we're going to probably end up doing is taking people's own fat. So, because taking about 3 or 4 tablespoons of fat and then processing it provides enough stem cells to treat someone's knee. It's been done, and it's being done in Europe. It's being done in Israel. A lot of the rest of the world. The FDA has not quite caught up with the understanding, and so it's not standard yet in the U.S. A lot of the stem cell treatments you hear about are using bone marrow, which is fine, but bone marrow stem cells predominantly make blood, right? That's their job.
Right.
Fat stem cells actually can go straight to cartilage cells. And so I think that's a superior technology that's eventually going to come. So I'm very excited about it.
So I like that. You get liposuction and stem cell.
Exactly. 2 for the price of 1, right? And it's about
Exactly.
a 30-minute procedure. It's pretty quick. So.
And Patty asks, can stem cells help with disc and back problems?
Absolutely. That is definitely the dream, because, the discs are complex because they have a soft inner part and then a hard ring around them, but they are just cartilage. And so when you talk about disc problems, that's just another manifestation of cartilage damage, of wear and tear arthritis in the body. And we make the distinction because the treatment sometimes is different. More injections, more focus on physical therapy, but absolutely there is potential for that. Thank you for that question.
So I had knee replacement surgery because I had no cartilage left in my left knee. Would stem cell implants have helped me with that?
They certainly could have. Like I said, 2/3 of people were able to regrow cartilage. Now, I don't know, if we're to the Star Trek level of, waving the wand over and the cartilage is normal, because that's been some of the challenges. How healthy is the cartilage? How long does it last? And it is true the definitive treatment is still getting a knee replacement. And knee replacement technology now is so much better because the knee is a very complex joint. So the original knee replacement's just bent, right? And that's how they moved. But the knee actually rotates and slides and has all sorts of motions. So the newer replacements really account for all those other types of motion. And that means they work better, but it also means they last longer. A successful knee replacement now can last 20 years or more.
Well, when I had my knee replacement, I remember asking my orthopedic surgeon, Dr. Pontius, how's the knee going to know what to do? And he said, don't worry about it. The nerves will take advantage of the new knee. So
Absolutely.
interesting. So mine does all that, up, down, backwards, round.
Absolutely.
And I don't have to think about it.
Thank goodness, because we are incredible machines until, of course, the cartilage starts to break down. So,
all right. So let me ask you last question. What haven't we asked you that you want to add to this discussion on arthritis and stiffness?
So it's a point I made earlier, but I want to reiterate it because I think it's important. It's that everybody's different, and I don't think in our Western medicine culture, we necessarily look at this as carefully as we should, but especially when it comes to arthritis and arthritis treatments, everybody is different. And so if you are struggling with arthritis, with chronic pain, with stiffness, keep looking, keep trying, keep searching until you find the right treatment for you, because your friend may have one thing that works, but there may be something else entirely that works for you. So my message is not to give up.
All right, now I need you to do me a favor.
Sure.
Take off your Dr. Wickersham hat and put on your Global Pain Association hat, because you're a board
Right.
member. And tell us first, why should people get involved in the Global Pain Association?
Well, I think it's for several reasons. One is that it's filling a need, which I think we are just beginning to come to understand. The burden of arthritis, of chronic pain in the community, right? And there's been a lot of push these days about opioid overdose and opioid abuse, but we really haven't had the corollary effect of, well, what do we do? How do we help people? If they can't take opioids, if they shouldn't take opioids, how do they get through their day? How do they take care of their kids, their grandmother, their mother, etc.? And Global Pain is really doing, I think, an excellent job in filling that need. And so our dream is that, these weekend GPA live sessions, the support groups locally, our web resources really spread out and become a model and a resource for people, most fundamentally.
Now, for folks who are watching who are interested in supporting the Global Pain Association, I know one of the challenges is funding. It's a tax-deductible donation. Why should people donate?
Because the money is being put to good use, right? So what we use the money for is very specifically to fund things like GPA Live and all the resources on the website, which is, again, I encourage you to check it out at globalpain.org, and also the support group. So this is not a for-profit thing. It all gets turned back into trying to help others.
Well, I really thank you. And if folks want to get a hold of your office, I know you're not meeting new patients at the moment, but you have colleagues who do. And if they call this number, they can find help for arthritis treatment.
Absolutely. Thank you, Ron.
Hey, thank you so much, Dr. Penn Wickersham. We hope to do this again. And let me remind folks who are watching that coming up on the next GPA Live, Saturday, May 8th, noon here on GPA Live, Seniors and Chronic Pain with Dr. Marisa Charles. Dr. Charles is a physician, sees primarily seniors in her practice, and she will provide a great overview on seniors and chronic pain. That'll be on the next GPA Live. Thank you all for joining us. Thank you, Dr. Wickersham. On behalf of the board of the Global Pain Association and our executive producer, my wife, Gina Galaviz-Eisenberg, we thank you so much for joining us, and we will do this again next week on GPA Live.